Schizophrenia is a mental disorder mainly characterized by abnormalities in the perception or expression of reality, usually manifesting itself in hallucinations, voices, paranoid delusions, or disorganized speech and thinking, often with a significant or social or occupational dysfunction. It does not necessarily imply the split mind, a dissociative identity disorder, also known as multiple personality disorder or split personality, but schizophrenia sufferers can experience severe difficulty in distinguishing what is real and from what is not. Noise in the brain of schizophrenics also results in cognitive impairment, memory loss, and attention deficits, resulting in difficulties in day-to-day functioning and learning.
Causes of schizophrenia. Researchers still don't know exactly what causes schizophrenia, but they do know that the brains of people living with schizophrenia are different, as a group, from the brains of those who don't live with the illness. Researchers strongly suggest that schizophrenia has something to do with problems involving brain chemistry and brain structure and, like many other medical illness, is thought to be caused by a combination of problems, some inherited and others occurring during a person's development. For example, some researchers think that schizophrenia may be triggered by a viral infection affecting the brain very early in life or by mild brain damage from complications during birth. Drug use can trigger underlying genetic weakness in a person. It is still premature to label schizophrenia as either a neurodevelopmental impairment of the growth and development of the brain or a neurodegenerative progressive loss of structure or function of neurons disorder, as both seem to be in play over the course of the illness. Scientists are working to understand if changes in the brain are present early in life and how much those changes worsen over time. People can develop schizophrenia at any age. About 1% of the world's population develops schizophrenia, meaning that out of all the people born today, 1 in 100 will develop the disorder by the time they reach age 55. About 75% of people living with the illness develop it between the ages of 16 to 40. Women typically have a later onset than men. Children can also be diagnosed with schizophrenia, though this is quite rare before the age of 12. New cases are uncommon after age 40. Extensive and intensive molecular genetic research programs continue to generate hope that specific combinations of genes will provide an answer to the riddle of what causes schizophrenia and other psychoses. Just like in the early stages of cancer and diabetes research, more time and innovative research are needed to learn more about this complex disorder.
Dispelling myths. There have been so many misconceptions about schizophrenia throughout history that it is best to begin at looking what schizophrenia isn't. Myth. Schizophrenia is the same as a split or multiple personality. Fact. The origins of the word schizophrenia have contributed to this confusion. In an effort to describe the mismatch he observed between the feelings and thoughts of people experiencing this medical condition, Eugene Buehler, a Swiss psychiatrist at the turn of the 20th century, proposed the terms schizo, which is split, and phrenes, which is mind, to capture this juxtaposition. Many people have confused this term with so-called split or multiple personalities, we now call dissociative identity disorder, but there is no relation between the two conditions. Myth. Schizophrenia is caused by bad parenting or personal weakness. Fact. Schizophrenia is a medical illness caused by a variety of factors including genetics, stress, substance use, and trauma, among others. Myth. People living with schizophrenia are violent. Fact. Almost all people with schizophrenia are not dangerous when they are engaged in schizophrenia treatment, although the behavior of a person in need of such mental health help can be unsettling or unusual. Violence is a noteworthy risk of some people living with schizophrenia who are not in treatment and who also have co-occurring alcohol or drug use problems.
The fact that schizophrenia occurs in all cultures means that schizophrenia treatment options should account for these differences in cultural context. Most people living with schizophrenia can manage their conditions with the interventions listed in this section. Long-term research demonstrates that over time, individuals living with schizophrenia often do better in terms of coping with their symptoms, maximizing their functioning while minimizing their relapses. Mental health recovery is possible for most, though it is important to remember that some people have more trouble when it comes to managing their symptoms. Although many effective schizophrenia treatment options exist, more research is needed to promote greater understanding and more effective treatments and potential cure for schizophrenia and other mental illnesses. Play the game, though it's unfair, they're all the same, who can compare?
still lose track.